Hi, it's the nursing professor back on our road to final exams and being successful in taking them. So today we're going to talk about fundamentals, one of my most favorite subjects to actually teach. So we're going to have 10 concepts. The first one is this. We need to know how to apply the nursing process, not just ADPI, but how do we apply it? So let me give you a quick example. You have a patient that comes into the hospital. They're newly diagnosed with diabetes. So you do your assessment. So A is for assessment. You do your assessment, you get the vital signs, blood glucose, subjective, objective information. All right, so based on that, then you come up with your diagnosis. It's a nursing diagnosis. So it could be knowledge deficit because this person is new at actually being diabetic, right? It also could be anything related to some of the symptoms that they are experiencing, like headache or PPP or something like that. Because if they're urinating a lot, they might be alteration in electrolyte imbalance because they might have eliminated too much urine. Then we're going to come up with our plan. Our plan should have goals that are measurable, short-term and long-term. And so an example of a short-term goal could be that that person's blood glucose is less than 150 within 24 hours. That would be a good one. Implementation is the actions that are necessary in order to get the person to accomplish their goals. So it could be insulin, it could be normal saline, it could be any of the PO medicines that that person may require. An evaluation, did you meet your goal? Was it effective or not? If it wasn't, then you start back at the drawing board in order to do something different. All right. We also want to know Maslow's hierarchies of need, knowing that safety is at the bottom. If you can't make that person safe, make sure that they have a place to go to, all of those things. Anything else above that at the top of the pyramid, you're not going to be able to reach. Also, remember your ABCs, airway, breathing, circulation. Those are always, always a priority. Then we move on to concept number 2, which is patient safety. Patient safety is going to be things like looking at fall prevention, medication safety, proper identification, knowing that you need to have 2 identifiers in order to know that you have the right patient, knowing about those 6 rights of medication administration, knowing about restraints that we very rarely use them, but if we use them, we have to check our patient every 15 minutes, making sure that their needs are met, going to the bathroom, making sure they have something to drink, and release those restraints. All right. So most times people have a 24-hour sitter. They don't even fool with those restraints because it's almost impossible to do every 15 minutes. The other thing is with those that you need to make sure that you have a doctor see the person face to face every 24 hours and sign an order for that. Okay. Can't be over the phone. They have to come in and actually see the patient. All right. We should also know about sentinel events, which means events that result in death, and near misses, because we want to avoid being a part of those. Infection control is concept number 3. Infection control and asepsis. We should know the importance of hand hygiene. We're going to wash for 15 to 20 seconds, soap and water. If we don't have access to soap and water, we can use the hand sanitizer. We want to hand sanitize in as we go into the room and as we go out of the room. Okay. No standard precautions. We treat everybody as though they are potentially infected. If we have somebody on airborne precautions, we're going to wear the N95, which we have to be fitted for. Example of that would be TB. Also know the other types of precautions like contact, droplet, airborne. Okay, so along with standard precautions. Know how to don and doff your PPE, know the order because sometimes questions will result in that. C. difficile can only be, you only can use hand washing with soap and water when you come in contact with C. difficile. Number 4 concept is vital signs and physical assessment. Go back to my video on physical assessment and you'll get all the details because it's a lot of overlap there. But mainly know the normal ranges of temperature, heart rate, respiration, blood pressure, O2 saturation. Know what those interpretations mean. Okay, so if somebody's 190 over 100, what does that mean? Are they high or low as far as blood pressure? Also know the BMI. Sometimes questions on BMI do come up as well. Number 5 concept is communication and therapeutic techniques. Again, that is on that health assessment video, but you want to be an active listener. You want to be empathetic. You want to use a lot of open-ended questions so that you can gather more detail as opposed to closed-ended questions that require a yes or a no. You want to eliminate any barriers to communication. So if your person speaks another language, then you're going to get a translator. If your person is hard of hearing, you're going to make sure that you have devices that amplify your voice, or TTY, where they can actually read what you're saying. If a person has a visual impairment, you're going to also make sure that that is available. So any barrier to communication, we're going to make sure we have a solution to that. Number 6 concept is health promotion and illness prevention. Remember these 3: primary, secondary, and tertiary. When we talk about primary prevention, we're talking about things like immunizations, because they help prevent disease. When we talk about secondary, we're talking about screening. So those are things like mammograms, colonoscopies, things that screen for disease. And T, or treatment, is for tertiary prevention, and that means treatment. So I always remember them by the first letter. P, prevention, primary; S, screening, secondary; and T, tertiary, treatment. All right. Number 7 concept is basic nursing interventions. Know how to do ADLs. Know the importance of turning, repositioning every 2 hours with passive range of motion if a person can't do it themselves. The number of times you should do range of motion is at least 3 times to the affected limb. Know which assistive devices that they are. Like if you have a cane, does the cane go on the affected side or the the uninfected side? Know things like that. Eyes and nose, drug calculations would also be one there. How to obtain labs, like when do you get a sputum sample? It's first thing in the morning. Make sure the person takes in a deep breath and really coughs out sputum and not spit. All right. 24-hour urine. How do you collect that? You ask the person to go pee, then you start the clock, and then you stop it 24 hours later. Number 8 concept is legal and ethical principles. Know that patients always have rights. We need to let them know about advance directives. We do witness signatures. There must be a consent on file for a person to have procedures, especially surgeries, and HIPAA. Can't be talking about everything to everybody. It's about right to know. The 5 ethical principles you should know is beneficent, meaning we do good; non-malfeasant, meaning we do no harm; justice is all about fairness; veracity is truth; and autonomy is about a person can make their own decisions. All right. Number 9 is documentation. If it's not documented, it's not done. So we want to make sure that we're doing that. Make sure you're documenting as soon as possible so that you won't forget. Remember SBAR. Again, that's on the health assessment video, but S stands for situation, B for background, A for assessment, and R is for recommendation. And number 10 is evidence-based practice and critical thinking. Know that nursing is an evidence-based practice. So we just don't do anything willy-nilly. There's a reason why we do what we do, and there has to be scientific evidence to help support why we do what we do. So it's like the best wound care for a particular wound. Those things like that have been tested. Recognize priority in nursing diagnosis and interventions. Which one should you do first? Know those types of things. And I think that's about it. I wish you all the success. If I forgot anything, drop it down below. Let me know how you did on your exam. And I will see you next video where we'll talk about mental health. Bye for now. Oh, don't forget to like and share this video. And if you know someone who is studying for NCLEX, then send it to them as well, because it gives them reminders of things that they really should go over. All right. Bye for now.